Hello and welcome everyone. I'm Ed McCauley, President and Vice Chancellor of the University of Calgary. I'm delighted to welcome you on behalf of our university to today's virtual forum, a conversation with the Right Honourable Brian Mulroney and Dr. Tom Stelfox, the Scientific Director of the OBrien Institute for Public Health. One of the driving beliefs for our university is that we're able to be creative and innovative precisely because of the relationships that connect us. I'd like to take this opportunity now to acknowledge that the University of Calgary is located on the traditional territories of the people of Treaty 7 region in southern Alberta. This includes the Blackfoot Confederacy comprising the Siksika, Piikani, and Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda, including the Chiniki, Bearspaw, and Wesley First Nations. The City of Calgary is also home to Métis Nation of Alberta, Region 3. It's this commitment to relationships and collaboration that allows our university to make an impact in areas like public health. We want to contribute focused research and create new knowledge that will change lives for the better, because the well-being of our society depends on the health of the people in it. And when we look at the leadership of the OBrien Institute, I think this work is a shining example of the impact that we're achieving together. The OBrien Institute is housed in the Cummings School of Medicine, with membership spanning 6 faculties and multiple disciplines. These researchers are shaping important conversations that span all aspects of our physical, mental, and social well-being. Their expertise drives new knowledge in local conversations around the fluoridation in water, national programs to improve the well-being of children, international guidelines used by the World Health Organization to keep us safe, and so much more. Most urgently, researchers at the OBrien Institute are informing protocols and creating solutions to address the COVID-19 pandemic. A great example is the work led through the Ward of the 21st Century, an OBrien-run entity which shares strong ties with Alberta Health Services. OBrien members have contributed to critical research and program implementation, and their leadership has helped make our hospitals and ICUs both safer and better prepared before and during the pandemic. Of course, this is just one example among many in which the OBrien Institute has led a path forward over the last 19 months. Later in the program, you'll hear a bit more about other impactful and unique initiatives. These innovations from the pandemic will forever change the way we approach public health. Today is about seeing the challenges, but also the opportunities that lie ahead for us. Our work is just getting started, and we are more than up for it. That is why we're so grateful to people like Gail and David O'Brien, who support these life-changing programs in research, innovation, and education. And thank you to Mr. Mulroney for his leadership on the national stage, and to our researchers for their dedication to getting it right. And of course, thank you to all of you for joining our university in this important conversation. It's now my great pleasure to welcome Gail and David O'Brien, founding donors of the OBrien Institute for Public Health. The O'Briens are visionary philanthropists and volunteers at our university, serving on multiple strategic advisory boards and supporting great research and education at the Cummings School of Medicine. Their commitment and advocacy have made the OBrien Institute a trusted, independent voice in public health. Both Gail and David hold honorary degrees from the University of Calgary, along with many other distinguished awards for their leadership in our city, our province, and beyond. Thank you, Gail and David, for your many contributions to the University of Calgary and for your role in today's event.
Thank you, Ed. And I want to thank everyone for joining us today. I am David O'Brien, and I'm here with my wife, Gail. And as you might have guessed, we are the founders of the OBrien Institute of Public Health. We're pleased to have everyone for this virtual conversation with our old friend, Brian Mulroney. I go back a long way with Brian. We first met when he was recruiting me to the law firm of Ogilvy Renault in Montreal in 1966. As you know, Brian is a very persuasive guy, and it wasn't long before he had persuaded me that I should go to the law firm. We were fellow law partners for a number of years, and during that period, I remember Gail and I going to Brian and Mila's wedding and thinking at the time, don't they make a great couple? Brian and I, a few years later, were the first to, I think, first high-profile departures from Ogilvy Renault. Brian went first to Iron Ore of Canada, where he became the president. And I moved out to Calgary to join Petro-Canada as its general counsel. And in that regard, I have a brief anecdote to tell you about Brian, which speaks legions. About 6 months after I arrived in 1978 to Calgary, there was a takeover battle that was launched for Husky between Petro-Canada and Nova Corporation. And Petro-Canada was starting to lose the battle, and it involved intricate legal maneuvers. I was terribly sick at the time and had just had 2 operations and was lying in a hospital at Holy Cross Hospital, basically out of the fray. What happened was that a message came in to the nursing station, because you couldn't phone me, I had tubes all over me. And the message, the nurse brought it in and she said, I don't know what this means, but what it says is, Husky buggered because you're sick, Brian Mulroney. And you can't imagine how well that made me feel in my desperate state. And it speaks legions about Brian, who always reached out to his friends across the country, and which made him such a successful politician. In subsequent times, Brian and I went on our way, but through a twist of fate, our daughters met in Toronto and at a nursery school. And each of Brian's grandchildren and mine were in the nursery school. And so it was a wonderful kind of reuniting through our daughters and our grandchildren. I want to say that Brian, like us, is deeply committed to making Canada a better place. And that's one of the reasons, probably the principal reason, why Gail and I decided to support the Institute of Public Health, because as you know, it affects us all, and this has become even more obvious through the pandemic. And we believe that supporting public health is a way to make Canada a better country. And now I'll turn it over to my wife, Gail.
Thank you, David. I couldn't agree more that public health is critical to the future of Canada. And the pandemic has indeed amplified many pre-existing gaps and issues in the public health care system, which must be addressed if we are to move forward as a healthier society. As well, though, it has also brought with it much innovation and many opportunities. And so now is the time to make it right, to take the steps to improve the lives of all Canadians, lives and health of all Canadians. And really, that is what today's conversation is all about, to take what we have learned during the pandemic to make Canada stronger, healthier, and fairer for all. And I honestly can't think of two more qualified and better people to lead the conversation than the former Prime Minister of Canada, the Right Honourable Brian Mulroney, and the Scientific Director of the Institute of Public Health at the University of Calgary, Dr. Tom Stelfox. And so I just want to thank Brian so very much for taking the time to be here today and to share his knowledge and experience. And I want to also thank all those of you who are here attending, and we look forward to your contributions to this conversation. And so now it is my great pleasure to turn to you, Tom, to lead this conversation.
Thank you, Gail and David O'Brien. As naming donors and inspirational philanthropists, we're grateful for everything you do to champion public health. As we heard, the OBrien Institute is a research institute located at the University of Calgary, and our mission is to advance public health through research excellence. We have over 1,000 members who primarily come from 6 schools and faculties at the university, but also come from organizations like Alberta Health Services, community organizations, and other universities. We function at the intersection of science and society, and one of our roles is a convener for knowledge exchange. So we have days like today where we bring together citizens, scientists, policy experts, with the goal to have research inform health in all policies. Why is this conversation important? Because COVID-19 has changed the world. 2 years ago, none of us had previously heard of this. Today, we live in a very different world. When the pandemic hit, members of the OBrien Institute stopped doing what they were doing and shifted their focus to the pandemic, studying a variety of issues, ranging from, for example, how do we help factory workers be safe at work? How do we address vaccine hesitancy? What are the impacts of the pandemic on the mental health of children and adults? How do we help health systems learn and adapt to overwhelming demand? Along the way, what we've learned is to have success in the current pandemic and to be prepared to prevent and manage future public health emergencies. We will depend on the policies we implement. And so because of that, we're so very fortunate today to have as our special guest, the Right Honourable Brian Mulroney, a great Canadian statesman with so much policy experience. Let me briefly orient you to our conversation over the next 45 minutes. There'll be 2 parts. In the first part, Mr. Mulroney and I will have a conversation about what we've learned from the pandemic and what we can do going forward. In the second part, we're going to open up to questions from you, the audience. Please use the chat box. You can start putting your questions in at any point. And understand that with over 1,000 people registered for today's event, we're unfortunately not going to get to everyone's questions. And what we'll do is we'll focus on those that are most frequently asked. And so without further ado, let me just say, there's nowhere else I'd rather be than here with you today to have this conversation with the Right Honourable Brian Mulroney, born in Baie-Comeau, Quebec, 18th Prime Minister of Canada from 1984 to 1993. As Prime Minister, Mr. Mulroney introduced important economic reforms, including negotiating free trade agreements between Canada, the United States, and Mexico. He led Canada as the first industrialized nation to ratify biodiversity and climate change conventions. He co-chaired the United Nations World Summit for Children, and he was part of an international effort to end apartheid in South Africa. Today, he chairs corporate and charity boards and has provided important commentary during the pandemic, urging reconciliation with Indigenous peoples and calling for action against poverty, systemic racism, and divisiveness. Welcome, Mr. Mulroney.
Thank you, Doctor. I'm very happy to be with you, and particularly grateful for the kind invitation of my old and valued friends. I say old just in the terms of our friendship, David and Gail O'Brien. David, of course, is from a distinguished Montreal family. His dad, John L. O'Brien, was one of our great lawyers and founded a very distinguished law firm. But they've had a whole reputation of public service and giving back to the community. In fact, today, these days, I'm chairman of a charity that looks after English-speaking in Quebec, throughout Quebec, English-speaking people with challenges in the areas of addiction and mental health. And David's brother, Peter, is serving on the board and has served on the board and makes a very valuable contribution. So that family tradition is being maintained out here. And I'm delighted that I've noticed the tremendous success of David's business career and the good work he's done and the generous leadership that he and Gail have provided for this OBrien Institute of Public Health in Calgary. Now, I'm not an expert, as Tom knows, in public health policy, but I have had considerable experience in the area of public health over the years, although that I acknowledge doesn't make me an expert. But Tom, let me begin, if I may, simply by telling you a fact that in some important ways applies. Last December, I had some urgent major surgery in Palm Beach for a burst aortic aneurysm. I went in on Friday. Mila sensed this whole thing was going south, and she got me in immediately. Thank God, saved my life, because the doctors were very pessimistic when they saw me. But they got me up. I got in at 5, and they had me operated on at 7 o'clock. I was operated on the doctors were excellent. The care was very good. I was operated on Friday night at 7 o'clock. I was there Friday night, Saturday, and I left Sunday noon. And I was on my way to recovery with a little gift they gave me on the way out. A bill for $318,000 US for 2.5 days in the Good Sam Hospital in Palm Beach, Florida. Now, that's quite a bill, but I immediately thought of, say a bus driver in Montreal or my hometown of Baie-Comeau or Calgary. What the hell does he do in this kind of a situation? Because in the United States, they have almost 40 million citizens who are completely uninsured. They've got an excellent system, high quality research, great doctors, great hospitals, and so on. But it costs twice as much per capita as the Canadian system. And there's still almost 40 million people uncovered by this policy, this universal policy. So what I did was, of course, I had to look after the bill, but first I said, thank you, Tommy Douglas. Because I think that Tommy's contribution and leadership all those years ago, has provided us with an excellent system of universal health care. But let's take a look at our system, and what you do is take a look at our system in Canada. As I said, the US spends almost twice as much per capita as Canada does, and they've got a great system that pleases them, obviously. Very entrepreneurial, very business oriented, very insurance company oriented, unlike our system, but they enjoy it. But their results, for example, infant mortality rates are higher in the United States than they are in Canada. Canadians live longer than the average Americans. So generally speaking, you'd say, well, we don't have too much to complain about, but we do. And that's the object of the OBrien exercise, and the leadership that David and Gail provide is namely to look at our system from time to time and try and make it better. Try and improve, as David says, improve the lives of all Canadians. And you couldn't find a more noble objective than our health, as I found out in December. When you're right on the verge of buying the farm, you don't think of very much else except your health, and hope you get the hell out of there at an early moment, which I was lucky enough to do. But at the Fraser Institute out in Vancouver, which is a very, very good academic institute, very recently, 3-4 weeks ago, compared the performance of universal healthcare countries in 2021. Some of you may have seen this, but if you haven't, it's the highlights of it are really worth repeating. It compared and looked at the guts of 28 universal healthcare systems in high-income countries like Canada. It concluded that Canada spends more on healthcare than the majority of the high-income OECD countries with systems like ours. In fact, it ranks second for GDP in expenditures on healthcare among all of the OECD countries. And it looks something like this. The report says that Canada, one of the highest spenders among universal healthcare systems, ranks modest to poor on performance. Healthcare spending as a percentage of GDP, which is the way it's been calculated forever since we brought in healthcare in Canada all those years ago. Canada is second of 28 countries. So we're a very high, we can't say that we lack the money to do the right things. Doctors per thousand, out of 28, we rank 26th. Hospital beds, out of 26, we rank, hospital beds per thousand, we rank 25th. The wait for specialists, Canada ranks 10 out of 10. Right at the bottom of the scale. Now, to give this stuff a little bit of life, you got to compare it to something. So let's compare it to Australia. Slightly smaller, they're about, I don't know, Australia would be about 26 or 27 million people today. We're about 38 million. But you know, we have the same backgrounds, essentially the same kind of economic and political systems. So our healthcare spending, we rank second. Australia ranks in 9th. Doctors per thousand, we rank 26th. They rank 10th. Hospital beds, they're ahead of us there as well. And the wait for specialists, we're 10th out of 10, and they're 5th out of 10. So we've got some problems with the fundamental infrastructure, Tom, as I see it, here in Canada. Now, you know, we're like other federations. We have one of the problems that there's not a one-stop shopping deal in Ottawa. We have 10 provinces and 3 territories, and there's significant differences in the way they finance themselves and the services they offer and the results that are possible. So what do we do? Well, I think that what we need on an urgent basis is a blue ribbon panel of eminent Canadian healthcare experts. I'm not talking about a royal commission that's going to go on for 10 years. I'm talking of a business-like blue ribbon panel to figure out what the hell has gone wrong, so wrong compared to our competitors, and tell us how to fix the system pronto. It doesn't have to be a perfect report, but it's got to be a quick report that deals with the fundamentals. And I'll bet you $1 to a donut right now that if I took people, half a dozen people from the OBrien Institute, they'd know what was wrong with the system. The doctors in Calgary and Edmonton and so on, especially given the tremendous experience that you've had this last summer in Alberta, the very painful experience. I'll bet you just in Alberta, the experts in the scientists, the doctors, the medical practitioners, they know what's wrong and they know how to correct it. So we urgently need, I think, a blue ribbon panel that's going to take cognizance of the stats that I just gave you and say, hey, this isn't good enough for Canada. We can do better. And let's take a look at this and we'll tell Canada and the federal government what's wrong and how to fix it very quickly. You know, I was a member of a royal commission that the Barassa government appointed in 1974. It was called the Plish Commission. The criminals had destroyed the James Bay project, which was a $6 billion project and the pride of Quebec at the time. And they shut it down completely because of violence. And God, there were shotguns floating around there. There were people being hurt. In fact, a couple killed. So the government appointed a royal commission. This is a pretty complicated situation. Not as complicated as healthcare, but very complicated. And Robert Clich and Guy Chevrette and I, who were the three commissioners, we brought in a report in 364 days with 60 recommendations that cleaned up the construction industry in the province of Quebec with 8.5 million people for 35 years. So if three characters like us could do that in that area, believe me, smarter people can do it in the healthcare industry. So, you know, Tom, I'm going to turn to you simply because you and I chatted at an earlier occasion about another one of my bugaboos, and we can get into that if you'd like, and that's the the anti-vaxxers.
Yeah, thank you, Mr. Mulroney. I think you've highlighted that in Canada, we've got a glass half full in terms of health and healthcare. We do well in some ways, but lots of opportunity for improvement. Can I ask, maybe to build on your comments, you know, you've written and spoken about opportunities the pandemic provides for us overall as a country to become stronger. Beyond thinking about how we improve healthcare, are there any other things that we should be focusing on or learning from our pandemic experience?
Well, yeah, I thought that we should, after the pandemic, and now I realize, of course, we're not completely through it, although I was hopeful until the last weekend. I was like everybody, I never thought that we'd had another one coming at us the way it is now. But I was asked some time ago that when we're through COVID-19, what do we do as a country? What should our objectives be, apart from, as the OBrien Institute reaffirms every day, look after the health of our and well-being, the wellness of our citizens better than we have in the past. Well, other things, a couple of other things we should do, and I was asked to lay it out in a special series for the Globe and Mail about a year ago, the anticipation being that by now we'd be out of it. And these items could be part of the throne speech that was delivered last week in Ottawa, but never were. No, I put forward the ideas, that just a couple of them. Full Indigenous justice by implementation of the Erasmus Duso Royal Commission, which provides all the answers. The answers for Indigenous justice are there. Look, we're not going to move any oil and gas with pipelines from Alberta or anywhere else until we resolve the matter of Indigenous justice. And the answers are in the Royal Commission. I appointed the thing in 1991. Brian Dixon wrote the terms of reference, the Chief Justice of the Supreme Court. The answers are in this brilliant Royal Commission. They're being ignored. Well, you can ignore them at your peril because you're not going to move any oil and gas. You're not going to build any pipelines unless and until this matter is resolved. It's fundamental to our national character. And so that's the first thing that I had put down. I also mentioned greater fairness and opportunities for our Black, Indigenous, and people of color, together with a national commitment to the eradication of systemic racism and anti-Semitism in Canada. It is absolutely appalling that a civilized nation like ours, one of the greatest countries in world history, would have these great blemishes of racism and anti-Semitism in our character. And so that has to be dealt with. Also, look, we're 38 million people thereabouts, and we're next to a country the superpower of the world with 300 and almost 50 million people. We have an economy with 38 million that produces a greater GDP than that of Russia's. So we're not doing too badly in terms of this, but we don't have the population necessary to continue to grow and to prosper and to look after the elderly with our pension plans and to provide the cash that's going to develop our healthcare system for the decades to come. So we have got to, as a national objective, have an objective to increase our population, our immigration, to an objective of 75 million people, at least, so that we can achieve our full potential. And we should have a priority examination of policies that guarantee a basic income for those Canadians living in poverty. Now, Tom, during the pandemic, you know, I have to confess, like others, that Neil and I were living okay throughout all of this. But, you know, I often thought, and David and Gail will remember these examples of a father, take it the opening months after March, April, May, June, here we are in July or August. A father of, say, 3 children, father and mother, living in Ville-LaSalle, outside of Montreal, here, one of our suburbs, in a small apartment, a 2-bedroom apartment, with no air conditioning, and he has just lost his job. That's before the federal programs came in and provided a lot of extra cash. He lost. Well, now, what the hell does a guy like that do? Can you imagine the despair in that household? This is completely unacceptable in a great, prosperous nation like Canada. We've got our priorities wrong in some areas, and that's one of them. So there's nothing wrong with us examining very carefully and promptly the creation of a basic, national basic income for Canadians who find themselves in that kind of a situation. Well, you know, a situation that is really, as you know, marked by despair and fear of the future for himself and his wife and his kids. We can't allow this to continue. There's a lot of money floating around here and in the world for us to do better by this important class of our citizenship.
Mr. Mulroney, you've highlighted some important social challenges we have that translate into how healthy we are and how we live as a society. One of the things that struck me during the pandemic is that we've had highly polarized public discourse on some of the very issues you've actually raised. You know, heated discussions on social media, protests both for and against public health measures. I can only imagine as Prime Minister, you obviously navigated some highly controversial and polarizing issues, such as free trade agreements at the time. How do we get past this mentality of us versus them and get people working together again?
Well, it's the problem, Tom, and the challenge of our times. Look, when I was there, I had the Rat Pack in the House of Commons indulging in character assassination every day. Politics of personal destruction were on view for anybody who wanted to see it. So there were areas of public life at that time that were not pleasant. And I have to tell you that I didn't think they were pleasant either. Look, when I brought in the free trade agreement and NAFTA, that I was accused of every crime in the history of humanity. I was giving away Canada. I was selling the soul of Canada. I was erasing the border between our countries. We were going to lose our official languages. We were going to lose our Medicare programs. We were going to lose our water. Some of you who may remember that election campaign, which has been described as the most brutal campaign in the history of Canada, 1988, and which it was. But, you know, look at, so if you look at all that criticism, look around today, say 25 or 30 years later, and I'm coming to a point. And you look around today and what have we lost? Our healthcare is there, our water is there, our official language, everything's there. The only thing we lost was some of our poverty, because we created with free trade an instrument that allowed Canada's economy that had taken 125 years to reach $800 billion to double that in 25 years and then double it again. So that today you say, what's the ultimate outcome? What's NAFTA today? And why was the Trudeau government fighting so hard to conserve NAFTA, to preserve it in the last year or so with President Trump? Well, because NAFTA is a grouping of 3 nations now with a population of about 500 million, which means that with 7%, that's what it represents, 7% of the world's population, NAFTA countries are producing 29% of the entire wealth of the world every year. And this is a great tribute to our 3 countries. And an example, as Winston Churchill said many years ago, this is an example for the rest of the civilized world. Now, what's the point? The point is that everything that was said, all the criticism that was said, was wrong. It didn't pan out, and we could have done without it. You have to accept some of that in a democracy. But what we've got going now, to come to your point, Tom, what we've got going now is infinitely worse than what I've just discussed with you, and how damaging that was for Canada had we not succeeded. If we didn't have free trade today, didn't have NAFTA today, and didn't have the GST today, what would we do for an economy that is we need as powerful and as rich as it is? Well, now we've got these anti-vaxxers, for example, talk about social media. You talk about loading poison into the system. They are I consider them the Luddites of modern healthcare, the anti-vaxxers and their friends. Thousands of doctors and researchers and scientists and healthcare responders, such as you see, the brilliant ones you see at the University of Calgary and in Alberta hospitals, for example, and across the country and around the world. People like this are saying the salvation to our problem and our challenge is vaccination and booster shots. And what do we know? We know they work, provided the entire population moves towards vaccination. So, and we have a guy, for example, my hometown is Baie-Comeau. So let's say we have a guy from Baie-Comeau or Red Deer who says, I don't believe in vaccinations. I'm an anti-vaxxer. By God, that he's the one you see on television at night, encouraging people not to get vaccinated. And this is the opposite of intelligence, and it's based on ignorance and misinformation. And so now, I didn't believe it until I saw it about an hour ago on television. Dr. Ronnie Jackson, a physician so able and distinguished that he was hired to be in the White House as one of the surgeons and doctors looking after the President of the United States. He just appeared with a statement. Now listen to this, a doctor who is now a congressman, a member of Congress in the United States of America, who said publicly that the new virus that they're talking about, the Omicron variant, this new one that we're all concerned about, he said today, the new virus is a hoax. It's designed, only put out there to elect Democrats in the next election year. I mean, this is absolute nuts. But I'll bet you that the way the media works down there, and to some extent here, to a much lesser extent, this is going to be promulgated, broadcast on all the programs tonight, and by tomorrow morning, you're going to have a large part of the American population wondering whether this new variant, which is a killer, just like the others, and requires the same stiff response that our doctors and our medical experts and so on articulate for us, There's going to be a hell of a lot of people in the United States of America and elsewhere, including in Canada. We're going to say, you know what? We think the guy's a doctor and he's a congressman. He must know what he's talking about. So he may be right. So I should be listening to him, not these other guys who are telling me I got to wear a mask and I've got to take all of these shots that concern me. So this is what we're up against. This is what the people who are on this call and the people at the University of Calgary who are busting their spirits, trying to get everybody vaccinated and so on. This is what we're up against. So when I talked about, the Rat Pack and the others that cause me so much problem, they're very minor indeed, very peripheral indeed, compared with someone who is making speeches, not about free trade, telling us how bad free trade is going to be. We're dealing with a guy who's telling us, do not get vaccinated. And so we don't get vaccinated. And guess what? We die. The United States is pushing, 800,000 deaths already. And you've got a former surgeon to the president of the United States of America and a congressman saying this thing that's coming in today is a hoax. I think, Tom, that polarization of thought and action that you mentioned, I think that we have to deal with this, and the only way you deal with it is by the truth. We've got to get out there and fight these guys, knock them down, destroy their arguments, and get everybody protected with vaccinations and all of the items that are recommended by our doctors and our specialists.
Thank you, Mr. Mulroney. I'm going to sort of jump to questions that are now coming in from the audience here, so we give people a chance to ask their questions. A question that came in that I think may seem like a nice follow-up to that is how can science help governments make good decisions around health? What's the best way that that scientists can provide a useful contribution so that our leaders can make informed decisions?
Well, the conflict, as I see it, Tom, is between science and ideology. We have nut bars out there who are articulating a philosophy that says, science, why would you listen to science when you can listen to me? This is the nut bar society that we have to deal with. But government, what can it do in a more practical way? I was reminding myself, actually, that way back in 1987, I'm going to mention this because it's important. We brought in legislation extending patent protection for brand name drug companies. Big Pharma agreed to spend at a minimum 10% of their Canadian revenues on R&D in Canada. This percentage eventually rose to 13% by 1998. This created thousands upon thousands of highly paid STEM jobs, science, technology, engineering, and mathematics here in Canada, and a lot in Calgary and throughout Alberta. But by 2018, 25 years after I brought this in, and 4 governments after I had retired, that number of 13% being reinvested in science, 13% has decreased to 4.3%. Now this is millions and billions of dollars no longer flowing to where they should flow. Rather than having institutions like the OBrien Institute doing more for governments, governments should be doing more for institutes like the OBrien facility. Governments should be investing heavily in R&D carried out at public institutions and universities. It also be creating the conditions to attract private sector R&D that's conducted at universities and institutes. Now, if you say you set a figure, let's just say a figure of 2% of GDP or 3% of GDP, which the real leaders are doing. We're going to be way ahead of the game. But the OBrien Institute, to take an illustration, which is doing an outstanding job, not only throughout Alberta and Calgary, but it's contributing to the informational knowledge around the country and procedures that we can adopt and so on. Why should the Institute be doing things for the government? The government should be doing things, should recognize the value of an institute like OBrien at the University of Calgary, a great university like the University of Calgary, and pump money into that and see what the results are going to be, rather than sit around in some bureaucratic enclave in Ottawa and not allow that money to flow to those areas where it should. So I think that while there has to be great cooperation, and there is, between the government and private institutes, private health institutes, and there is great cooperation, it can be a lot better. We see from the earlier numbers I gave you from the Fraser Institute. And now we're in a situation, and what happened here? Well, the successive governments did not provide those major pharma companies with the protections that they needed, that we brought in 1987, that they need to ensure huge investments for long-term gain. And we weren't giving them enough patent protection, so that has to change. I think that whole area has to be looked at again. We should try and make Canada a welcoming, a very welcoming land, the most welcoming in the world, if we could, for these large pharmaceutical companies who invest large amounts in research and development, allowing us to hire young scientists and young doctors and young healthcare professionals in places like Calgary and OBrien.
Great. Thank you, Mr. Mulroney. Another question that's come in, it's a follow-up to your comment about the Erasmus Dassault Royal Commission. You highlighted that, that's 30 years ago that we had recommendations that focus on restorative justice. And here we are 30 years later. Why do we continue to struggle as a nation to address our colonial history, systemic anti-Indigenous racism, and our relationship with Indigenous people? It feels like we're stuck. How do we get unstuck on this key issue?
You get unstuck with leadership. Prime ministers are not elected to seek popularity. They're elected to provide leadership. As someone said, someone wrote, in a nation like this, or even newspapers hire focus groups to see what kind of news people want, we have lost sight of something we should have known as teenagers. Just because something is popular doesn't mean it's right. So what is the leadership? Leadership, Bill Clinton once said, and I think that Bill was right, very right on this, that leadership is the capacity to look around the corner of history just a little bit. If you're the prime minister, you have to try and do that. And sometimes when you look around the corner, you don't like what you see. But those are the challenges out there that will be in the Canada of our children and grandchildren. If we don't take them on and do them, irrespective of the unpopularity, then they're not going to be done, and Canada is going to stall in its present position forever. And so look around the corner of history now. Just take a very selfish view. If you're from Calgary or you're from Alberta, just take a selfish view. Look around the corner. What do you see with this item about justice for our Aboriginal peoples? Well, I'll tell you what I see. You look around the corner, there's going to be no development to speak of and no transport via new pipelines to speak of, which there has to be. Because, climate change is not going to solve our problems tomorrow. We're going to be on Alberta oil and gas time for a long time to come. Otherwise, the country cannot exist. Nothing's going to happen overnight. It's going to take a lot of time. So if you look around the corner of history, you see paralysis that's going to set in respect of any future planning in the energy sector and the transportation of energy through pipelines. And this is very, very bad for Alberta and for Canada. So the Prime Minister should have everybody sit down and say, here's the problem. Here's the solution. Now that we've met and we've negotiated. And I am going to bring in this thing for the pipelines and to develop Alberta resources and so on. Everybody's going to share in it. The provinces, the Aboriginals, the pipeline companies themselves, everybody's, Canada is going to promote, generate enormous trillions of dollars in resources. I mean, we have 175 billion barrels of oil on the ground in Alberta, which many people want to keep there. They don't want to develop, even though the world needs it and will continue to need it for decades to come. So from a selfish point of view, if I'm in Alberta and I know we need jobs and so on, it is in our interest, in our selfish interest, to insist upon a solution to the Aboriginal problems, because the absence of a solution is going to block all development of significant measure of Alberta resources. It has to be done, apart from the moral imperative upon us to resolve something that has been a blight on our citizenship since the country was founded by Sir John A. Macdonald 154 years ago.
Thank you, Mr. Mulroney. Another follow-up question to something you spoke about earlier. You highlighted that immigration is key to our future, and yet the pandemic has disproportionately been hard on many new Canadians, partially because many of them work in frontline jobs. So what can our governments do to make these jobs safer?
Well, first, we've got to have a program to get more people in here. Our birth rate is down, and our immigration, as you're reading in the press these days, our immigration policies and the machinery of it is so stultifying that we can't get immigrants in here to speak of, even if we want. Now, last year or two, they got immigration up to 400,000, which is starting to get respectable. But if you're going to raise it to 75 million, you got to get it up to 600,000-700,000 a year. And there are jobs. I mean, look, the Premier of Ontario is on television every day saying he's got 200,000 well-paying jobs right now that can't be filled. Alberta is in a similar predicament. Quebec is one of the great challenges that came from the Premier of Quebec over the last weekend from the opposition parties was the absence of workers. The private equity people, the entrepreneurs, the business people, they're all screaming for workers. And they're screaming for the government to open the gates of immigration, controlled immigration, but generous immigration, in a manner that we can achieve that objective of 75 million down the road. So I think that our problem, Tom, right now is not the jobs, because all the jobs in Canada are pretty good. You know, we have a minimum wage that's very high now, but I mean, everybody's paying over the minimum wage just to get employees. So we've got a new minister of immigration in Ottawa, Sean Fraser from Nova Scotia, is a very good man. And I think he sees clearly what the problem is and what the future is. And so you've got to render much more supple and flexible the whole immigration process, so that people do not wait for months and months and months simply to have their letters acknowledged. It's got to go lickety-split if we want to deal with this pandemic. Have you noticed that during, for example, the United States and the United Kingdom and Canada, during the pandemic, at the doctors and healthcare experts who are on television talking to us every night, how many of them are immigrants? Have you noticed that? There's never been a wave of immigration in Canada from the Irish in 1832 to the Ukrainians to the Jews. There's never been a wave of immigration that hasn't brought enormous benefits to Canada. Never. And so here we are with a dilemma and a challenge. And as I once said, Canada has a problem with immigrants. We don't have enough of them. We've got to open up the gates and bring them in to help us build the kind of society we need, including helping us pay for the elderly needs that are Canadians in the years to come. And we don't have enough young people to pay for the elderly in healthcare and other things. So for a very selfish reason, we've got to open the gates and bring enough people in to help us continue building this magnificent country.
Great. Thank you, Mr. Mulroney. So that brings us to the top of the hour. And I'm sorry, I see there's many more questions in the chat that we're going to have to leave for now. I think we've had a lively and informative conversation. I've certainly learned a great deal. And so let me finish off by, first of all, saying thank you, President Ed McCauley. Thank you, Gail and David O'Brien. Thanks to everyone on our video conference who attended. I appreciate you participating and sharing your questions, of which we got to some. And finally, a special thank you to you, Mr. Mulroney, for sharing your time and experience with us.